I will say this group cleans up pretty well. I'm still trying to figure out who some of them are. Welcome, everybody. My name is Dr. Linda Spencer, and I'm the program director and a professor here at Rocky Mountain in the MS Med SLP program. I am honored to serve as your MC this evening as we recognize the dedication, the intelligence, and the works of this group of Cohort 6 of the MS Med SLP students for this white coat ceremony. This ceremony marks the transition from didactic classrooms, sitting on your buns learning, working in the clinic learning, and in our internal clinic, which is led by our faculty, to starting in just a few weeks your clinical externships. I want to begin by acknowledging the presence of our faculty, our staff, our students, and we have some dignitaries tonight. But at first, before I do that, before I forget, I want to express our gratitude to Tyler Anderson, who organized the event tonight. He's taking on the role of event and experience coordinator along with his day job as senior director of the University of Marketing and Communications. So just to acknowledge our administrative guests tonight, who we have here. First, we have, it's not in order of where they sat. We have Daisy Rosado Cantrell, who is the Chief of Staff. We have Mr. Stephen White, who is the Executive Vice President of Communication, Marketing, and Enrollment. We have Janine Ravilio. I made her say it 10 times just so I can do it. Who is the Director of Student Affairs. And then last but not least, we have the President of the University, Dr. Cam Martin. Now, throughout this evening, you're going to have an interlude with one of our faculty members. They're going to introduce themselves, and then they're going to introduce the next person who is speaking. So we're going to start it off tonight with Dr. Danielson, and she assures me she will be nice and she will behave. She is going to come up and introduce the president.
I'm Dr. Priscilla Danielson, and I'm a faculty member here. And I have trouble with names, and with all the makeup, it's just worse. So, thank you. My job is to introduce the president of our university. President Cameron K. Martin became the second president of Rocky Mountain University of Health Professions in January of 2023. Before becoming president, he worked as vice president of operations and chief of staff for the Office of the President at RMU. Prior to that, he was the vice president of university relationships at Utah Valley University. He oversaw and assisted with all public-facing university efforts. He also worked for the Utah System of Higher Education as an associate commissioner for economic development and planning. President Martin earned a bachelor's degree in political science, a master's degree in public administration, and a PhD in educational leadership, all from Brigham Young University. He and his wife, Julie K. Martin, have 3 daughters. Please welcome me please join me in welcoming President Cameron K. Martin.
Well, thank you, Dr. Danielson, and you were kind, so you can also not be and have some fun at my expense. At least my children do all the time. So, welcome. Congratulations! Isn't this great? Woo! Woo! You came in the room doing that, and you're going to do that all night, aren't you? This is great. This is great. Well, mom, dads, fiancés, friends, family members, husbands, wives, everybody, thank you. Welcome. Welcome here. to Rocky Mountain University of Health Professions. Welcome to our new home. Not even a year ago, in just December, we moved into this space, and it's beautiful. Now, we kept the blinds open, and some of you are talking about, we got to lift these blinds, and we did, so you could just see the majestic valley in which we sit in and at the feet of these Rocky Mountains. Now, there's some folks from Colorado. This is the correct side of the Rocky Mountains, just for the record of it all. Now, we're glad to have you here, truly are, because it's important to celebrate inflection points in your lives, in your careers, and this is an inflection point, right? This is a point where you've come so far and have yet more journey yet ahead of you, but to celebrate what you've accomplished so far. That's why we have these white coat ceremonies. And more of that will be explained to you later. But I wanted to simply just say to you, congratulations and thank you, because your efforts are making a difference. You're learning a skill that people need. That's amazing, right? You've chosen a profession to make a difference in another person's life. That's amazing. In fact, one of the things I love about the profession that you've selected is that you're going to help people communicate better. That's special. Move up there. And he was telling me about his daughter, who wasn't expected to live past 2 or 3 or 12 years old or 20. She's turning 37. And she's bedridden and has a myriad of issues. But because of the gift of a person such as yourselves, who have seen different things going on in her lives, she's actually starting to see things that she's never seen, and she's learning how to communicate in ways she's never been able to communicate. Because of speech-language pathologists who took the time to not just write her off as somebody who was a case too hard, but as someone who deserved an opportunity to experience in better communication with her family. And so the miracles do happen, and it will happen due to your efforts. We want to say thank you for that. Now, you're getting a little nervous, I'm sure, because you're heading off to this next venture, but you got this. You got this. You're laughing, right? You got this. Come on. One of the things I want you to remember, if there's anything that I say today that I want you to remember, and that is to trust your training. Our outstanding faculty have pushed you, have mentored you, have laughed with you, I'm sure cried with you, and everything else in between to prepare you for this next stage in your training and your educational journey. Trust your training. Trust it. And in that moment, you're thinking, wait, what do? Just breathe, go back to the training, go back to the basic, and begin. Inch by inch, vowel by vowel, whatever it is, just begin, and you'll all of a sudden discover you're in the groove, and you'll discover miracles do happen. Now, there's one other thing I want you to remember, because you'll go out, you'll have your IDs with you, and in that moment of worriness, on your white coat, there's our logo. Have you ever stopped to consider what the logo involves and looks like? So look at that. It's a hand that creates the mountains and the valleys, the valley that our headquarters are in, right? But that's your hand. That's your hand. And it represents the training you've received. So again, when in doubt, stop, look, I've been trained for this. I got this. Go in confidence, because you have been trained well by our faculty. Now, we're in our 25th year as an institution, and I'm the second president only since this last January, because our founding president, Richard P. Nielsen, was the president for 24 years. Very uncommon in the world of higher education. He and our other co-founders established this institution based out of need. And we lean into the opportunities to help people through the various programs that we offer here at Rocky Mountain University. There are many a need that is going unmet. That is our mission, to meet those needs. In fact, our vision is to improve the human condition. And I like to say, how do we do that? By these students who are on that next level of their journey to graduation. You got a little ways to go, but you're going to get there, who have been trained to love and lift those in need. And we have some of our PT students here and colleagues think this is fun. Applies to all of our students. We love and lift. We see people. To love them is to see another person, to see them where they are, who they are. And to lift them is to deploy the skill that you've been trained through your expertise that you're developing and have already mastered in some ways. That's the lifting. That's the miracle. That's where it happens. So we're glad to have you here, moms, dads, family members, friends, and colleagues. And we're glad you're here, students. We really are students. I mean, you're colleagues. I mean, it sounds really pedantic. I apologize for that. But you are students. You're still learning and growing. And we're glad that you're here with us on that journey. And we're really glad for the lives that you will now go out and impact for good. Welcome to Rocky Mountain University. You're not here to listen to me for the rest of the night, so it's my time to sit down and be quiet and enjoy the rest of it and to celebrate your opportunity before you. So congratulations to you. Let's hear it. Let's hear it. All right, thank you.
So here I am again. The students asked me to say a few words, and I think they just really they picked me because they know I like to tell stories. So I'm going to tell a story. In the maritime provinces in Canada and around the Great Lakes and in New England and in states, the Great Lakes states like Wisconsin and Minnesota and Michigan, live tribes like the Anishinaabe, the Ojibwa, and these peoples tell the story of a creator called Gitche Manitou. So Gitche Manitou is the creator. And Gitche Manitou was looking at the people that he created, the men and the women and the children, and he saw that there was suffering and there was sickness and there was misery. So in order to ensure that his creation thrived, he created medicine men and medicine women to provide for relief from that pain and that misery and that suffering. And it is not just in the Anishinaabe and in the Ojibwa, but it's all throughout the whole world where we see these peoples. And we see tribes all throughout the United States, but we see peoples in Europe and in Asia, in India and in Africa. And these healers come in various names. There's the name Bomo, you've heard of shaman, curandero, the Midieso, Kalawea, and in the upper Midwest, these healers are called Midewin or the Midday. And because I can say Midday, and I like to say the word Anishinaabe, I'll talk about that tradition. So in the Midday people, the Midday, there's a man or a woman who heals. And Gitche Manitou, as I said, the creator, was believed to have sent signs for the original Midday to teach the Midday these methods or these ways of healing. And they sent spirit animals to help these Midday learn the traditions of healing. They sent spirit animals in the form of the owl, of the bear, of a chicken, of a bee, of an eagle, of a prairie dog, of a raccoon, even a kitty cat. These Middays in training also learned from these spirit animals, and they had to make pilgrimages far away from their villages. And they had to go through grueling times of training. They had to live sometimes in or they had to spend times in a sweat lodge where they fasted and where they didn't have enough water to drink, where they didn't sleep, and it would sometimes come to be that they would have visions, and that was how some of the original Medei learned some of these ways of healing. The Medei societies kept all the records of what worked and the evidence that worked and the evidence that didn't work on something called the Wigabasabak, which is a birch bark scroll, to preserve their teachings. They also had many oral teachings, they had symbols, they had stories, they had history, and pieces of wisdom that were passed along and preserved from one generation to the next. A Medei practitioner is initiated and ranked by degrees. Much like our degree in speech pathology, we have an academic degree, but a Medei or a healer practitioner could not advance and cannot advance because these people exist today. They cannot exist to the next higher level until they complete the required studies, experiences, ceremonies, and achieve the competencies associated with that next level of the degree. And as I learned about the Medei people, I kept thinking, well, speech pathology has been around a long, long time and everywhere. We just didn't know it. But what's intrinsic to the Medei people is that desire to help relieve suffering. And as I looked through all of your statements of purpose, there was this universal piece that I saw in the words of the people, the words of our people, the words of our students that came to us. And so I was looking at their whys. And I think you'll see the theme as I recount some of the words of our students. There was the student who recounted the effort to keep an orphaned calf alive by hand feeding that calf. And she noted that it's the continuous small things that make big things happen. Or the student that said, I had a dream of performing on Broadway, but I decided I would not feel fulfilled in an environment focused purely on my own success. Or the student who had an experience as a 5th grade teacher who encountered a child with a stutter and was inspired to pursue speech-language pathology. Similarly, one of our students was inspired by their own niece and by another child with Angelman syndrome. Another student was inspired, and it's just uncanny, to relieve suffering related to the struggles in communicating as informed by the people of Rwanda, Nigeria, the Congo, Burma, and Micronesia. Another student came to our field via anthropology's holistic lens that anthropologists use to look at communication and the values and how communication influences one life. Or the student that said, I notice the individual and unique qualities about others, and I'm able to build strong foundation with people that I'm meeting. Another student says, the way we communicate and express our thoughts is how individuality is demonstrated. There is nothing more exciting than assisting a person in either discovering who they are or recover who they once were. Another student says, I want to attend Rocky Mountain University to help meet the needs of my community as an SLP while eliminating language barriers due to lack of communication. And this one gets me. So I want to wait a minute. I'll never forget that sinking feeling in my stomach. It's hot in here. When I realized that no one in my 1st grade classroom was speaking the same language as me. As a result, my early school years were very challenging, often leading to teachers mislabeling me as quiet or uninterested, when in fact, I was known as the funny and the loud one at home. Another person was inspired by their memory of watching an SLP. At 4 p.m., a woman would knock on our door, come to our kitchen table, and work with my brother for an hour. I was completely mesmerized by this. She was different from any other teacher I had ever seen before, as she patiently worked with him on those weekly and monthly communication goals to help build his confidence as a young person and student. Another student recalled an experience she had working at United Cerebral Palsy and the shift in perspective that she received from an individual she worked with who, when often if they were upset or angry, would have a lot of problems processing their thoughts. Another student took experience from her home in Brazil, took that experience to Poland, and then to the US with the realization that an SLP must be skilled in dealing with people, be able to put oneself in another person's shoes, and treat them as you would like to be treated, and be a great communicator with compassion. This one, I never saw an SLP growing up, not even for career day. I don't think it would have made a difference since this service would go unused in my community, because seeking services is sort of taboo. I want to bring them into light, these services, in communities like mine. My goal as a speech pathologist is to bring awareness and representation and to end these cycles. Another student was drawn to RMU because of the values here, the learning centeredness. I took to mean that you do everything in your power to provide high quality learning and environment, and that you can do everything that you do to encourage individual learning, and the value of service. And this desire to serve others is one of the main reasons that SLP has attracted me to this profession. Another student has a goal to help those who have lost language due to a stroke or an injury, to help them to become the person they are capable of becoming, and to create a sense of belonging in the world again. Another student says, as a clinician, it is my desire to be able to provide quality services that include cultural awareness and sensitivity as top priority. And as an aspiring clinician, I want to use my voice to advocate for those who have not been heard. We have a student who recalled writing about a client in transition. She says, I think the LGBT plus community is utterly inspiring. Their community is forcing change, modernizing society, and forcing equal and deserved rights. We have a student who says, I've always been interested in medicine and education, and speech-language pathology is the perfect combination of the two. A student who was a nanny noted that one of the children in her care received speech services, and after a few weeks of therapy, the child started making notable progress in his speech. And they stated that his journey made this student realize that this was the profession they wanted to pursue. For another student, it was a chance meeting with a professor who explained the field, and she launched into a vigorous and impassioned explanation of the field, and 5 minutes turned into 50. That doesn't happen very often in our field. We don't talk a lot. One student recalled her first telehealth observation experience. A young boy was smiling from ear to ear and promptly put his hand up and said, hello. And the twinkle in his eye drew her in. And finally, it was the skills of a speech-language pathologist that taught my grandfather how to swallow. This woman might have felt she was just doing her job, but it meant so much to him. Remembering the change I saw in my grandfather impacted me deeply. It is one thing that reminds me that even if something is challenging, it is possible to overcome. So it is in these words that we see the spirit of the Anishinaabe, the Ojibwa, and the Meday who strive to fulfill the intent of Gitche-Manadu. This group has now met the milestones. They have learned how to complete assessment protocols. They've employed the rubric of assessment, choosing the diagnostic questions, gathering data, employing treatment principles. They've imbued themselves with counseling principles, and they're now ready for this ceremony to send them off to the next advancement in their paths to complete 3 external placements with practitioners who have completed their ceremony of advancement. And we, as the faculty, have incorporated the preserved teaching of our mentors. And while we don't usually use birch bark, we do employ oral teachings, symbols, technologies, tools, history, and pieces of wisdom. We have found that you, our protege Mid-A, are ready to take your next path, and our own spirit animals delight in celebrating with you as we commence the donning of the white coat.
Good evening. My name is Dr. Phil Sectum. I'm an associate professor in the MS Med SLP program. And they've been saying they've had a hard time recognizing some of you, but I was right on because yesterday in class, after your headshots, I got some good practice there. So I knew exactly who you all are. So I would like to introduce the co-president of Cohort 6, Madison Sagely Rose Carapino. Came to RMU from West Covina, California. She received a BA in politics with a minor in Spanish from St. Mary's College of California, Moraga, California, and went on to complete prerequisite courses for her graduate program at Citrus College in Glendora, California, and San Diego State College. Madison Carapino.
Thanks, everyone. Welcome families, faculty, and fellow MS Med SLP Cohort 6 students. Today we gather here for the Med SLP Cohort 6 White Coat Ceremony. This is a celebration of our incredible journey, marked by dedication, growth, and the pursuit of excellence in the field of medical speech-language pathology. As we wear these white coats, we symbolize our readiness to embark on clinical externships that will shape our professional futures and empower us to make a difference in the lives of those we serve. Before we proceed, I want to express gratitude to our families. Your support, understanding, and encouragement have been instrumental during the first year of our graduate school journey. You have stood by our sides and cheered us on every step of the way. Today, we share this milestone with you and acknowledge the immeasurable impact you have had on our journey. I also want to take a moment to recognize some of the other remarkable individuals who have played an integral role in our development and some reasons why we are ready to spread our wings and start our clinical externships in the fall. Dr. Spencer, you have been an unwavering pillar of support. Your personal stories and unconditional support have enriched our learning experiences, both inside and outside of the classroom. You have taught us the importance of self-care, reminding us that we must prioritize our own well-being to effectively care for our clients. Ms. Chase. You have brought out knowledge within us that we didn't even realize that we had. Your guidance has taught us that it's okay to not have all the answers yet, but to engage our speech brains and think critically. You have emphasized that articulating our thought processes is our speech superpower, empowering us to navigate the complex clinical landscape. Dr. Sectum, you have been a dedicated teacher, guiding us through the intricacies of neuroanatomy, motor speech disorders, voice and resonance disorders, and dysphagia. Your countless hours spent answering our questions and going above and beyond the classroom expectations are a testament to your commitment to our cohort. Your scoping bootcamp experience will undoubtedly make us more competent and confident during our clinical externships. Dr. Danielson, you have consistently provided invaluable advice at the perfect moments, even when we didn't realize we needed it. You taught us that every child needs a safe place to learn new things. Your belief that everyone deserves a voice and that communication takes many forms has resonated deeply with us. Your encouragement to model and wait expectantly has shaped our understanding of effective therapy and patient-centered care. Dr. Stockdale, you have worked tirelessly to ensure we recognize what a normal swallow looks like. Your dedication to training us in documentation through countless SOAP notes has prepared us to confidently enter our clinical externships. We are grateful for the knowledge and skills that you have imparted upon us. Ms. Stonier, your unwavering support and challenge to think outside the box have been transformative. You have taught us that failure is not an end, but an opportunity for growth and learning. Your belief in our abilities and the grace you have shown us during our graduate school journey have instilled confidence within us as we approach our clinical externships. And finally, Ms. Ibsen, you have encouraged us to keep doing the things and have redefined our understanding of creativity. Your ability to see both sides in every situation has broadened our perspectives. Your unwavering support and guidance have been invaluable in shaping our professional growth. As we prepare to embark on our clinical externships, let us carry the lessons and support of these remarkable individuals with us. They have nurtured our knowledge, skills, and resilience, preparing us to deliver exceptional care to our future clients. The clinical experiences ahead will be both challenging and rewarding, but we have been equipped with the tools necessary to make a positive impact. To my fellow MS Med-SLP Cohort 6 students, congratulations on reaching this milestone. As we transition into the world of clinical practice, let us continue to support and uplift one another. Our shared experiences, knowledge, and camaraderie will be our pillars of strength during this next phase of our journey. To our families and loved ones, thank you for your unwavering support, understanding, and encouragement. Your belief in us has fueled our determination to succeed, and we are immensely grateful for your presence in our lives. As we venture forth, let us wear our white coats with pride, knowing that we are ready to make a difference in the lives of those we serve. May our clinical externships be filled with compassion, growth, and meaningful connections. Together, let us embrace this opportunity to leave a lasting impact in the field of medical speech-language pathology. Congratulations, my fellow MS Med-SLP Cohort 6 students. Our incredible journey is just beginning, and I cannot wait to witness the remarkable contributions we will all make in this field.
Well done, Madison. Very well done. My name is Wendy Chase. I am the Director of Clinical Education and an Assistant Professor here at Rocky Mountain University. It's just fascinating to look at these faces and recognize that they are so different than they were less than a year ago when they started this process of getting to this point. So Dr. Spencer mentioned a little bit about the donning of the white coat and what that means. I'm going to add a little bit to that. This ceremony marks a milestone in your education, and we use the term milestone now to mean very meaningful points within your educational process. This is one of those very meaningful points in your educational process. It started as a tradition from the rite of passage for medical students, moving from the didactic to the externship role, and it has expanded from that time to other allied health professionals, representing the same basic meaning, which is, you got it. You're ready to go and do the thing. Thank you, Ms. Ibsen. Out in the world. And we have the privilege of handing to you the white coat representing that ability to go out and do the thing as you go forward. So you're going beyond the structure and the routine and the familiarity of your internal education at RMU into that external environment. So you know the length of your coat is short because it represents your status still as a student. Okay? You get to spend your own money to get a longer one later on. Before we go too much further forward, I would like to have Lauren Murray please stand up and face everybody. Lauren Murray is our clinical placement coordinator and is through her tireless efforts of constant communication across this country that you will actually have a place to go for each of the next 3 semesters. And I think that she deserves an even louder round of applause than that. Thank you, Lauren. All right, one more thing before I sit down. I'm going to share my spirit animal and Dr. Spencer's, and I'm hoping that everybody else, oh, and Dr. Sectum's, that gets up who will share theirs as well. But the students, you know this, you can explain to your family members why we have these spirit animals, because you probably figured it out by now. Dr. Sectum's is the groundhog. Mine is the owl. Dr. Spencer's is the eagle. Dr. Danielson has a spirit accoutrement in terms of a handbag. Take that for what it's worth. And the rest of you can introduce your own. Anyway, it is hopefully through our use of those spirits that we have influenced your ability to get to this point. I certainly hope that we have. So we are going to move forward now to Dr. Stockdale.
Think I'm the raccoon? Is that right? It's hard deciding on one animal to represent you. So I'm Dr. Tim Stockdale. I work with these individuals in the clinic primarily as an assistant professor of speech pathology in our pro bono clinic with individuals who have survived head injuries, vascular incidents, and have communication and swallowing disorders as a result of that. It's my pleasure to be here. I've had a wonderful experience working with these students and with my colleagues, and it's great to see you all come this far. Good job. With that, good job. I heard someone started. I mean, go ahead. You deserve lots of those tonight, so just keep it going. So with that, Sasha Herget is going to be introduced soon. She is our clinical coordinator and our dual job and our program administrative assistant. And so she's going to be reading the names of the white coat recipients here in just a moment. And each student is going to have a unique faculty member provide their white coat to them who has been a special mentor for that student throughout their journey and throughout the rest of your graduation. So with that, Sasha, I will turn it over to you.
After some very intense observation in my first few weeks with the Med SLP department, Ms. Stonier chose my spirit animal, which was the koala. And I think that was spot on. So, our first recipient is Brindley Bosworth. You got it. Kylie Bullock. JC Hayden. Whitney Chapman. Myra Fonten. Veronica Holguin. Claudia Gaddam. Kimberly Garcia. Abby McCormick. Aaron Connolly. Biana Mazer. Dennis Tripes. Jenny Weigel. Margie Pearson. Aspen Vojcic. Olivia Richter. Caitlin Ellis. Amanda Ryan. Marky Cup. Taylor Smith. Robin Wright. Madison Carapino. Belle King. Anna Savvy. Congratulations to our 2023 MS Med SLB White Coat recipients.
Hello, congratulations to all of you. I am Kristen Ibsen. I am one of the clinical faculty members here and an assistant professor. So I've had the opportunity to work with all of these students in the clinic, in our clinic here on campus for the past year. So now in our program, we're going to invite Madison, where are you, Madison, back to the stage to lead the class in reciting their oath to their patients and clients.
This is in the program if all of y'all want to read it along with me. Okay. As I begin my clinical service, I dedicate myself to promote the autonomy of my patients, to serve with beneficence, to act in their best interest, and to assure they will benefit from my care and treatment. I will strive for justice and access to treatment, to preserve the dignity and confidentiality of those I serve, and to communicate with my patients and their loved ones with honesty and truth. As a speech-language pathologist, I promise to work towards advancing science, setting standards, fostering excellence in professional practice, and advocating for those I serve. I vow to practice with integrity, humility, honesty, and compassion, working with other healthcare professionals to provide the best possible care for my patients.
Cohort 6, you look good in white. Good job. Okay, my name is Elby Stonier. I am also an assistant clinical professor and have had the pleasure of working with lots of you in the clinic. So I'm really happy to be here and see you move away and go away from us. It's a good thing. My animal is a bee, because it's not very big, and if you're allergic, it'll kill you. Oh. Yes. And also, Miss Ibsen's is a chicken, which doesn't really say anything about her personality, but my own child was a patient of hers early in his life, and he could not say Kristen. He could only say chicken. And so it has stuck, and I think actually most of us call her chicken. Anyway, nothing else really in common with the animal. Okay, so next we will have Abby McCormick, who came to RMU from Ridgecrest, California. She received a Bachelor of Arts in Environmental Studies, very closely related, from the University of California, Santa Barbara, and went on to complete her prerequisite courses for her graduate program at Chapman University in Orange, California. Abby?
All right, and I will be leading us in the mission. So the mission of the Medical Speech-Language Pathology program is to encourage autonomy and passion amongst one another and make meaningful contributions to the field of speech-language pathology. We strive to demonstrate competence within our scope of practice and educate others on our field service.
We are dedicated to lifelong learning by engaging in reflective and collaborative practice. We aim to express our enthusiasm for patient care through holistic patient-centered therapy services. We seek to illuminate total communication and well-being of patients by recognizing their diverse and individual needs. Finally, we subscribe to the belief that communication is a human right and commit ourselves to giving our patients the respect and priority that comes with this absolute.
So that concludes our white coat ceremony. We send you off on your own path in the image of Gitche Manitou, go forth and conquer. Thank you.
If we could get the whole cohort, some in front of the stage and some on the stage so we can get a group photo. We weren't able to get that the other day. But we invite all the guests. We've got cookies and drinks over here, so please come and start partaking of the desserts.